Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on leukemias, each with 4 answer choices and detailed explanations. Vignette 1, Acute Lymphoblastic Leukemia, ALL. A 6-year-old boy presents with fever, bone pain, and easy bruising. Physical exam reveals pallor and hepatosplenomegaly. Labs show anemia, thrombocytopenia, and 20% lymphoblasts in the bone marrow. What is the most likely diagnosis? A. Chronic myeloid leukemia, CML. B. Acute lymphoblastic leukemia, ALL. C. Acute myeloid leukemia. D. Hodgkin lymphoma. Answer B. Acute lymphoblastic leukemia. Explanation: AL is the most common childhood leukemia. It presents with bone pain, hepatosplenomegaly, and pancytopenia. Bone marrow biopsy shows 20% lymphoblasts. T1 translocation has a good prognosis. Vignette 2, Acute Myeloid Leukemia, AML. A 55-year-old man with fatigue and recurrent infections has a CBC showing anemia, thrombocytopenia, and circulating myeloblasts. Peripheral smear reveals Auer rods. What is the most likely diagnosis? A. Acute lymphoblastic leukemia, ALL. B. Acute myeloid leukemia, AML. C. Chronic lymphocytic leukemia, CLL. D. Myelodysplastic syndrome. Answer: B. Acute myeloid leukemia. Explanation: AML occurs in older adults and presents with cytopenias and myeloblasts with Auer rods. The APL subtype, T1517, is treated with all-trans retinoic acid, Atara. Vignette 3, Chronic lymphocytic leukemia, CLL. A 72-year-old man presents with fatigue and painless cervical lymphadenopathy. CBC reveals lymphocytosis with smudge cells. What is the best initial test to confirm the diagnosis? A. Bone marrow biopsy. Flow cytometry. C. Philadelphia chromosome testing. D. Peripheral blood smear. Answer: flow cytometry. Explanation: CLL presents with smudge cells and lymphocytosis in older adults. Flow cytometry confirms clonal expansion of CD5 plus B cells. Vignette 4, Chronic myeloid leukemia, CML. A 45-year-old man has splenomegaly and leukocytosis, WBC 100,000. Peripheral smear shows immature granulocytes and basophilia. Which genetic mutation is associated with this condition? A. JAK2 mutation. B. T22 Philadelphia chromosome. C. 1517 translocation. MIC amplification. Answer: B. T chromosome. Explanation: CML is caused by the BCR-ABL fusion gene, T2, leading to uncontrolled granulocyte proliferation. Imatinib, tyrosine kinase inhibitor, is the treatment of choice. Vignette 5, Hairy cell leukemia. A 60-year-old man presents with fatigue and massive splenomegaly. His CBC shows pancytopenia, and a TRAP stain is positive. What is the most appropriate treatment? A. Rituximab. B. Cladribine. C. Imatinib. D. Hydroxyurea. Answer: B. Explanation: hairy cell leukemia is a rare B-cell malignancy that presents with TRAP-positive hairy cells. Cladribine, purine analog, is the preferred treatment. Vignette 6, Richter transformation. A 68-year-old man with chronic lymphocytic leukemia, CLL, develops rapidly enlarging lymph nodes, fever, and night sweats. Biopsy reveals diffuse large B-cell lymphoma, DLBCL. What is this transformation called? A. Philadelphia crisis. B. Richter transformation. C. Tumor lysis syndrome. D. Myeloproliferative crisis. Answer: B. Richter transformation. Explanation: Richter transformation occurs when CLL transforms into an aggressive lymphoma, typically DLBCL. It presents with rapid lymph node growth and B symptoms. Vignette 7, Myelodysplastic syndrome, MDS. A 75-year-old man with a history of benzene exposure presents with fatigue and recurrent infections. CBC shows macrocytic anemia, thrombocytopenia, and neutropenia. Bone marrow biopsy reveals dysplastic myeloid precursors with ringed sideroblasts. What is the most likely diagnosis? A. Aplastic anemia. B. Myelodysplastic syndrome, MDS, scenic myeloid leukemia, CML. D. Acute myeloid leukemia, AML. Answer: Myelodysplastic syndrome. Explanation: MDS is a pre-leukemic condition that causes ineffective hematopoiesis and cytopenias. It is associated with benzene exposure and chemotherapy. Vignette 8, Tumor lysis syndrome. A 19-year-old man undergoing chemotherapy for all develops acute kidney injury, hyperkalemia, and hyperuricemia. What is the best treatment to prevent this condition? A. Allopurinol. B. Hydroxyurea. C. Rituximab. D. cladribine. Answer: A. Allopurinol. Explanation: tumor lysis syndrome occurs after chemotherapy, leading to electrolyte imbalances. Allopurinol or rasburicase prevents uric acid buildup. Vignette 9. Philadelphia chromosome in acute lymphoblastic leukemia. A 20-year-old man is diagnosed with acute lymphoblastic leukemia, ALL. Genetic testing reveals the Philadelphia chromosome. How does this affect prognosis? A. No effect. B. Better prognosis, worse prognosis. D. Requires immediate splenectomy. Answer C. Worse prognosis. Explanation: Philadelphia chromosome, T922, is usually seen in CML, but when present in all, it indicates a poor prognosis. Tyrosine kinase inhibitors, imatinib, improve survival. Vignette 10. Hyperviscosity syndrome in Waldenstrom's macroglobulinemia. A 70-year-old man presents with blurred vision, headaches, and Raynaud's phenomenon. Serum electrophoresis shows monoclonal IgM spike. What is the most appropriate initial treatment? A. Plasma exchange. B. Rituximab. C. Imatinib. D. Cladribine. Answer: plasma exchange. Explanation: Waldenstrom's macroglobulinemia is an IgM-producing lymphoma that causes hyperviscosity syndrome. Plasma exchange is the first-line treatment. Final thoughts. This set covers